is the Emergency Medical Minute.
Okay, so we're going to talk about an interesting article that I read the other day. First of all, it's going to be a two-part medical minute. So a person comes in with chest pain, right? Let's say it's maximal at onset. What are you thinking about? Like it's just like boom, severe tearing pain. Aortic dissection. Great. What are other things that would make you think of aortic dissection? Let's just stick with the aortic dissection thing for a second. So maximal at onset, tearing in nature. What are other things that make you think about aortic dissection?
Uneven pressures.
Uneven pressures or uneven pulses when you're feeling them? What else?
Weak peripheral pulses in the feet.
Yes.
White or bad color in the feet versus the upper.
Yep, so sometimes you can get ischemia from a really severe dissection. Weakness, exactly. Neurologic symptoms plus chest pain. Because these people can dissect in their carotids and they present like strokes, right? So we've had actually a few stroke alerts that we find out, oh my gosh, they've got a huge aortic dissection and that's what's caused their stroke. And then so tearing radiates to the back is another common one, right? Tearing radiates to the back, maximal on onset, any type of neurologic symptom. One thing I'd say is chest pain that travels. So chest pain that's starting in the chest and now they're having severe abdominal pain or feeling pain in their legs. And that's because that dissection can just continue to propagate, right? So if you see weird stuff and they have chest pain, dissection should be on the list. Now, risk factors for dissection, I think a lot of us know, like if someone looks like they've got Marfan's, they're at risk for dissection. But there's actually a common medication that we give out that increases people's risk of aortic dissections. Do you know what it is? It also affects tendons. Levaquin, fluoroquinolones, right? So fluoroquinolones, they did this interesting study in Taiwan where they had all these aortic dissections and they did a review to see if they've gotten fluoroquinolones, and fluoroquinolones doubled people's chances of having aortic dissections. So when you see this like risk pop up when we give fluoroquinolones, is overall we're trying to give less and less fluoroquinolones because they are not a benign drug. When you look at just tendon rupture, that's like, yeah, it's important because, you never want someone to have to go to surgery because they tore their Achilles. But they also cause really big kind of neuropsychiatric problems. So with old people, they cause a lot of delirium, a lot of confusion. There's rare cases, but they cause like severe neuropathy, where people have lifelong neuropathy because of fluoroquinolones. The other thing that causes, of course, like most antibiotics, is really bad GI side effects. So they predispose them to C. diff, predispose them to other infections there. But just another reason to have really big caution with fluoroquinolones and to try to use other medications, substitutes for treatments of infection when they exist.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.